Good afternoon, everyone. I assume that we have a quorum and we can, let me pull up my agenda here. So, welcome. And at this point, we will go ahead and do a formal roll call for our board meeting.
Okay, Dr. Jameson?
Here.
Valerie Clark?
Present.
Levon Lewis?
Present.
Dr. Sarah Friedman?
Present.
Jonathan Johnson?
Here.
Jose Melendrez?
Here.
Quincy Branch?
Present.
Suzanne Bierman?
Here.
Commissioner Richardson? I see you. I'm going to mark you as here. And then Aaron France for Susan Brown. Are you here, Aaron? Okay. Well, we'll mark him attending if he does show up. Madam Chair, we have a quorum.
Excellent. Thank you to our Executive Director, Heather Kervolick, who it is, I would like to announce it is wonderful to welcome her back. I thank you for your amazing public service that you do and continue to do for our state of Nevada, and it is just wonderful to have you back. In addition, I'd like to thank Dr. Cook for his term, and as you know, Dr. Cook is no longer with us, and we now have our new board member, Dr. Sarah Friedman. I'd like to thank Dr. Friedman for looking at this as an opportunity and joining our board. And I don't know if it's appropriate, but Dr. Friedman, maybe you might just for a second tell everyone who you are, where you're from, and what's your specialty and why you're on our board. Thank you.
That sounds great. Thank you for the introduction. I'm an assistant professor at UNR in the School of Community Health Sciences. I'm a colleague of Dr. Cook's. I teach health policy. I teach undergrads about the exchange, and master's students. I've had folks from the exchange come to speak to my students, which has been really wonderful. My research is around access to behavioral health care and access for gender-specific care for women in the VA.
Excellent. Thank you so much for joining along. And so what I'd like to now do is ask everyone if they've had an opportunity. I hope that you have had your opportunity to review the minutes from June 29th, 2020, and for someone to make a motion to accept those minutes. Do I hear a motion?
Jose Melendrez, motion to accept.
And a second?
Valerie Clark, second.
Thank you, Jose and Valerie. And is there any discussion? Does anyone, after reviewing those, think there was any edits, omissions, or additions you would care to make? Hearing none, I would call for everyone that is in favor of accepting those minutes from June 29th, 2020 board meeting. Please say aye.
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 Anyone oppose? Does anyone abstain? The minutes from June 29th, 2020 are passed, accepted. Now,
Dr. Jameson, I'm sorry to interrupt. I just want to make sure we don't neglect our public comment.
oh,
I know we have someone waiting.
Interrupted because I did want to always, that's one of my most anticipated things. And I got sidetracked with the announcement with all that excitement. So yes, thank you very much. Let us go back to public comment. Do we have any public comment in the north? Or since we're on since we're on a Zoom, we're not divided up. Any public comment?
Yes, can people hear me?
Yes, we can hear you,
I
Barry.
can hear and
Okay,
recognize that is Barry.
fabulous.
Please.
Yes, for the record, this is Barry Gold. I'm the Director of Government Relations for AARP Nevada. It is always a pleasure to speak to the HealthLink board. I would like to add my thanks for Heather for all that she has done for the exchange, and it is so good to have her back. I emailed her earlier and I said she is truly a consumer advocate and she's helped Nevada families immensely. My public comment today has to do with the agenda item of the special enrollment period, the market stabilization enrollment period, which will effectively extend the open enrollment period at the end of the year. AARP would like to formally support that. Anything that we can do to assist Nevada families in getting access to quality health care by getting insurance is a great thing. So we'd like to go on record as supporting that agenda item. Thank you very much.
Thank you, Barry, as always, for your input. And is there anybody else for public comment?
Katie, do you want to help me tell people how they can raise their hand for public comment? I see we have some other folks have joined. I just want to make sure we're making, they know how to go ahead and ask for to be unmuted.
Yeah, absolutely. So at the bottom of your screen, you can either raise your hand, you'll come up on the chat and I can unmute you, but at this time I have everyone allowed to talk. So if someone has a comment, go ahead and unmute yourself and you can make the comment now.
I think we can safely say that that's nobody's volunteering.
Yes, hearing no other public comment and keeping in mind there's another opportunity at the end of the meeting. So let's go ahead and move to agenda item 4, approval of the market stabilization special enrollment period to extend for plan year 2021 open enrollment period through January 15, 2021. We talked about this at our last board meeting and now we are presenting it here for possible action. Do I hear a motion?
Jonathan Johnson, motion to approve.
Levon Lewis, second the motion.
Thank you. Are there any comments about the motion?
So this is Barbara Richardson. I do have a question. Yes, I'm here, Heather. I had to come in a different way. What if you signed in January 15th? When would your coverage start?
Thank you for the question, Commissioner. That's a good question and something we've been strategizing in terms of marketing. So anybody who enrolls after December 16th through January 15th would have a February 1st start date.
So is there any concern then that folks would not have coverage through the month of January, given that the normal time period is calendar year?
That is, sorry, I'm getting a message here. The February 1st date does align with our federal rules and how the federal platform operates. And yes, of course, that is a concern. That's why when we do our marketing and outreach, we'll be careful to be telling people to get enrolled by December 15th in order to have the 1/1 start. And then to basically say, now you have another month and you can get enrolled for February 1st start date. I'd also add that we anticipate that people will continue to have a kind of fluid situation with their employment and their employer-sponsored coverage. And if and should that be the case, whether it's Medicaid or it is employer-sponsored plan, you would have a special enrollment period that would extend for 60 days beyond the date of from the date that you lost your coverage. So there's quite a few safety nets built in.
Okay, and then my only other question has to do with being able to count like those folks who start at different dates, because there's a sort of a drop dead when you have folks who are actually fully into the exchange after a certain time period because they've paid their premiums for a period of time, and so they've gotten past their grace period. Is that that date gonna be changed as well?
There will be no adjustments to grace periods. Those are all handled by our insurance carriers. And when we outlined this plan to our carriers, they did not have any concerns.
Okay, thank you, that helps.
Thank you, Commissioner. Those are very good questions. And I also want to thank the exchange, because many of our people, which is common human nature, they sign up at the last minute. And if we do get the usual last minute signups around January 15th, I'm always impressed at how quickly that even by February 1, you expect to get those people on board and get their cards to them and get them going, or at least their number, always. Going on then with the, any other comments about the stabilization special enrollment period? I would just say that I anticipate, with the way things are going with the COVID crisis and our Nevada's incredible employment and decrease in insurance coverage, that I think this comes in the most timely fashion. And I'm so happy and excited that the exchange has come to what it is today with this amazing platform that we'll be able to offer this incredibly excellent product with superior technology at a time when Nevadans could not need it more. So having said that, I'm ready to take a vote and say, anybody that would like to vote in favor of this special enrollment period, please say aye.
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 Is there anyone opposed? And any abstinence? So we have, the board has just unanimously approved the market stabilization special enrollment period to extend plan year 2021 open enrollment period through January 15th, 2021. Okay, item number 5, board delegation of the authority to our executive director, Heather Korbulik, to make litigation decisions regarding the lawsuit entitled State, X REL. Insurance Commissioner versus Silver State Health Insurance Exchange. Now, Heather and our consultants, I did specify executive director as Heather Korbulik, but of course, if she was run over by a bus, should we leave it at the open-ended executive director to make the litigation decisions? Yes, okay, so I just restated that. Do we have anybody here that would like to make this motion?
This is Martin Lewis. Oh, and I move that we delegate the responsibility for litigation decisions regarding this lawsuit to our executive director.
Second?
Second.
Second by Jose.
Thank you. The motion has been seconded. Do we have any discussions, further discussions on this motion? Hearing no discussions, I'll entertain a vote. Everybody in favor of delegating the authority to the executive director to make litigation decisions regarding the state insurance commissioner versus Silver State Health Exchange, please say yay.
Yay.
Okay.
Is there any opposition? Is there any abstinence?
Yeah, the Commissioner Richardson abstains.
Thank you, Commissioner. Okay, that goes noted. And the board has just approved this motion for board delegation so that the executive director can make those litigation decisions. I thank you, Heather Korbulik. And just for public record, I would like to clarify that the board will be appraised of the ongoing, given updates on this ongoing issue. Thank you. And then discussion of possible actions regarding dates, times, and agendas for meeting in the future. When is our next meeting?
I was all set up for answering that, Madam Chair. Heather Corbula for the record. Our next meeting is set for October 8th, and we are planning to give you an overview of preparation for open enrollment for Plan Year 21. Also provide you with a sneak peek of our campaign, our advertisement campaign, and provide you with any federal updates as they relate to our operations. So please let me know if there's anything else the board would like to hear.
Excellent. And we are again so excited to have you back to see us through this next open enrollment. Is another opportunity, if anybody has joined us or anyone present has thought of any public comments that they would like to, please raise your hand and we will entertain your comments now.
This is Jonathan. Maybe a potential item for our next meeting.
Oh, sorry, Jonathan.
Yeah, that's okay. Or maybe you know already, any anticipated changes in carriers coming into the exchange, new carriers, new plans, that sort of thing, or existing carriers that do not intend to offer plans for the 2021 plan year?
Thank you for the question, Jonathan. All of that information should be public, I believe, by September, and I'm more than happy to share that with the board. And if the board would like, we can and will be making that public at the time. So as soon as it's available, as soon as we're able to, we will share that information.
Excellent question, Jonathan. Thank you. Any other questions on future agenda items? I know at the end of the last board meeting, we mentioned a couple items that we were going to get follow-up. And other than those, I had no additional myself. Was there anything for anyone else? Hearing none, then once again, we'll give public comment an opportunity to go ahead and raise your hand and speak, please. Anyone with public comment? Hearing no public comment, I just want to thank everyone for joining us today.
Sorry, interrupt real quick. I have Thomas on here raising his hand for a public.
Oh, wonderful. I'm sorry because I can't see that on mine. Thomas?
Yes, my name is Thomas Blissett for the record. I just have a quick question. With the extension that that the board just approved, does that also apply to off marketplace plans as well?
I'm going to let Heather answer that. And usually we just do public comment. We're only allowed to listen to your comment, but I think that's a legitimate just formality question. Heather?
Thank you, Madam Chair. So for the record, the special enrollment period that was just added is for exchange plans only. And so we're only voting to extend our open enrollment period on exchange.
Thomas, thank you for that question. Was there anybody else that has a question?
That's all I see.
Was that yes?
No, it was Katie. Sorry, I was saying I didn't see any other questions on my end.
Thank you so much, Katie. And again, once again, thank you, board members, for joining us in the meeting today and for your support for access to healthcare for everyone in Nevada. Thank you. Have a wonderful, wonderful day.